Welcome, everyone. I'm Catherine Lavender, the Data Project Manager for NACDA, and this is our NACDA Data on Aging podcast series. NACDA is the National Archive of Computerized Data on Aging at ICPSR at the University of Michigan and is funded by the National Institute on Aging. We seek out and preserve data relevant to gerontological research, kind of like a data library, curating the data as needed to promote effective research use, and we share the data with the research community free of charge. We are proud to say that we are one of the largest libraries of data on aging in the United States, offering opportunities for secondary analysis on major issues of scientific and policy relevance. We hope to connect with the gerontological research community using this podcast series and plan to highlight data resources and researchers, talk through data concerns, and learn the stories behind the projects. You can find out more about NACDA and ICPSR by visiting NACDA-aging.org. Today, our guest is Dr. Josh Ehrlich, a clinician-scientist specializing in epidemiologic and health services research and the clinical care of patients with glaucoma, cataracts, and anterior segment disease. His research focuses on addressing the adverse impact of vision impairment on health, disability, and quality of life, with a particular focus on older adults. He is also co-director of the Kellogg Eye Center for International Ophthalmology, and we met through the NACDA director, Dr. James McNally, and the Sense Network, an international network supporting research examining the role of sensory functioning, vision, hearing, olfaction, touch, and taste on health and aging. Welcome, Josh. Thank you for doing this with us today.
Thanks very much for having me.
Yeah, and so I'm going to let you and Jim talk through about your research, and yeah, let's get started.
Okay, well, first, full disclosure, Dr. Ehrlich is not just a colleague, he's also my eye doctor, and reflects the wonderful blend of research and fine medical care at the University of Michigan. So it's interesting way these paths overlap, but it's great to have you on the podcast. And I noticed we had a couple of other overlaps too that I wanted to touch base on first. What kind of anthropology did you do as an undergraduate?
So it's going back a few years now.
Sure.
But really my interest in things health and medical were actually, as you say, born out of anthropology. I'd studied medical anthropology at Washington University in St. Louis, and was introduced to thinking about the relevance of culture and different systems of healthcare to the way people conceptualize and deal with illness. And truth be told, that really informs my work nearly every single day, even still.
Interesting. Yeah, because I trained in forensic anthropology at the University of Maryland, and got very, very deeply involved in skeletal structure and the identification of the dead. And in many ways, the anthropological models at that time, medical anthropology was just emerging. There was, the sociological anthropology, but the medical anthropology is fascinating. It's just an interesting overlap.
Oh, definitely.
I also wanted to ask you about, just real quick, about your work with the World Health Organization and the global burden of disease. I work with them as well out of Kobe, and I was curious, what you thought about the international expansion or the international collaborations, particularly on eyesight.
Yeah, so I'm part of a group that's run out of the UK called the Vision Loss Experts Group that brings together dozens of researchers and clinicians worldwide with expertise in various topics related to eye care and certainly various regions of the world. And the idea behind the Vision Loss Experts Group is to really act as sort of a clearinghouse, an expert group that brings together the relevant data that can inform the global burden of disease study and some of the WHO's goal setting and prioritization. and really it's it's a broad collaboration. It's sort of continuously updated, and has been a gratifying collaboration because it brings together so many great people, and I think has done a lot to inform the GBD work and GBD estimates around eye care. A lot of that work has also fed into something called the Vision Atlas, which is a really wonderful resource that's curated by the International Agency for the Prevention of Blindness, and really allows data users and interested parties really sort of point and click access to global burden of disease estimates in a very user-friendly fashion on the IAPB website.
That's great. That's really, I mean, yeah, one of the things we face as gerontologists is this focus we have on certain kinds of disabilities among the aged, but we always seem to be not giving enough attention to eyesight and to dental care, simple things that people take for granted, but have such an impressive and overwhelming impact on the quality of life that many older people have in terms of, you know, living independently and doing things. And that was how we first, you know, really got engaged, was the presentation you gave at ISR a few years ago, and then talking about the Sense Network, which is really opened my eyes to a lot of different activities and opportunities for team science and multidisciplinary research. How did you make that transition, you know, just across your career? I mean, you know, starting in anthropology, medicine, but often the decision to be a researcher or a strict clinician is a challenging one for many physicians. So how did you find yourself where you are today?
Yeah, that's a great question. As I left studying anthropology and thinking about health and well-being through an anthropological lens, I shouldn't say left because I still do in many respects. I knew that as I went to medical school and pursued clinical training, that I wanted to do something in addition to clinical care. And I wasn't necessarily sure as I began my clinical training what that would look like. But at some point, I realized that I wanted more quantitative methodological training to be able to do research. That was where I wanted that extra something to be. And so I pursued a Master of Public Health degree. Took some time out from medical school to get that degree before returning to medical school, and then subsequently pursuing my specialty training in ophthalmology. And so once I made that commitment, I was quite sure that I was going to be leveraging those quantitative skills for epidemiological and health services type research going forward. And that's in fact how things have played out. Sort of concurrent with making that decision to go to public health school, I was turned on to the field of ophthalmology and to the problem of blindness and vision impairment. And although, as you mentioned, Jim, blindness and vision impairment, sensory impairment more broadly, aren't necessarily thought of in the first or articulated in most gerontologists' first breath when they think about causes of disability. In fact, there are billions of people worldwide living with sensory impairments. And we know that sensory impairments affect so much more than just how one sees or hears the world, but affect economic well-being, social well-being, act as risk factors for a host of other comorbidities, and are even associated with early mortality. And so to me, vision impairment and blindness as a public health problem really represented kind of the perfect target, so to speak, because we have effective interventions for these things. And much of what the public health problem is identifying the people who are in need and getting those interventions to the people in need. No small task, but just the fact that effective interventions exist is a great place to be starting from.
That's great. I mean, you know, it staggers the mind, the amount of work you face as both a researcher and a clinician, but I guess the next step is how did you sort of coalesce all of this interest into the work you're doing now with the Sense Network and some of your other research interests? What do you see as sort of your central objectives or goals of your research work?
Yeah, I mean, I sort of fell into, I'll say first, I sort of fell into the world of gerontology by accident. And that simply was, my interest is certainly, and my knowledge and expertise has developed from here. But initially, it was really just very practical. It was that 80% of vision impairment and blindness exists in people 50 and older. And so to me, this was the obvious population to really begin to study. And I became more interested in gerontological syndromes and other diseases of aging with which vision is associated or an important component of the disease, for example, dementia, falls. And so understanding that that vision and sensory health in general is associated with so many aspects of well-being, disability, independence in late life, and that we have effective interventions to address vision impairment and blindness specifically, but other sensory impairments more broadly. We're continuing to learn more about how vision impairment impacts on other distal outcomes, economic well-being, social well-being, health, gerontological syndromes. As we learn the mechanisms, and this is what much of my research is focused on, is understanding the pathways, the mechanisms through which sensory impairment affects some of these outcomes, we then are, as a community, are working to translate, we've begun some of this work, those understandings of associations and mechanisms into potential interventions that may actually arrest some of these processes and change the tide when we think about how vision affects even non-visual aspects of one's life, particularly in later years.
Yeah. Oh. So this is, there's just so much going on. You're NIH awardee, you work with NHATS, you've got foundation research, a variety of things. But what would you consider to be a particularly important or satisfying result that you've been able to share with the research community from your work?
Yes, I mean, I'll highlight a couple. First, one of the most gratifying things that we've been able to accomplish in recent years was creating some new data for the community. It's still surprising to me that the last time we had, in any survey setting, nationally representative data on objectively measured vision health in the United States was in 2008 in NHANES. Since 2008, there have been no such data available. And so we saw that as an opportunity, as well as, of course, a gap. And we designed a battery of in-home vision tests equivalent to the clinical gold standard tests. And we've shown that in some data that we've published. And these new tests are implemented in the 2021 and now, in just a couple of months, the 2022 fielding of the National Health and Aging Trend Study, or NHATS. So these data will be released in the next couple of months with the 2021 NHATS data, and will provide to the gerontology and vision community the first nationally representative data in well over a decade.
Wow, that's impressive. We can't wait to promote that.
Wonderful. We're certainly happy to have NACDA helping us and NHATS to promote that. And the same is actually on the hearing front as well. There's audiometry data that's being collected annually now as part of NHATS.
That's great. That's really exciting. I mean, that it fills that need that we've all seen, but we just can't find the data. Small community studies are nice, but they don't have that generalizability to base policy on. So that's wonderful news.
Exactly. And we certainly hope to leverage, and I'm sure others do as well, to leverage that data to really learn more about how vision and hearing impact the lives of older adults in ways that the data just really hasn't been there to do. Since these data are going to be collected annually, we'll be able to do not only trend, but also trajectory analyses, which is very exciting.
Great. That's great. Okay, well, I'm going to ask Catherine to step in, our project manager, and to do some additional probing of your career and thoughts.
Great.
Yeah, that is substantial. People do still come to us for NHANES. We have, you know, I think one of the last years of NHANES we have is actually 2008, 2009. And so it will be great to be able to direct people to NHATS for the data that you talked about coming out with NHATS. That's exciting.
It is.
So can you talk about some of the challenges you've faced throughout your research processes with, collecting the data, but then also, going through and discovering where the gaps lie in existing collections? Yeah.
Yeah, so I mean, I think we've highlighted really, I would say, the major gap in existing collections, which is that, well, there's a lot of great survey and self-report data out there. And I don't mean in any way to sort of demean the value of self-report data as it pertains to sensory health. I think there is certainly value there, and self-reported sensory health data is measuring a certain construct that's highly correlated with objectively measured sensory function, but is a slightly different construct. And so as we've been doing a lot of work over the past several years trying to understand the ways in which sensory health impacts older adults, this major gap that we've come up on is that we are only measuring one dimension of sensory health, and that is that self-reported difficulty, disability type construct, but we don't have that physical functioning piece, which is really what we will get from these objective measures. On a national scale, certainly there are smaller, clinic and geographically constrained studies that provide physical functioning data. So that major gap is there in the United States, although we're surmounting that now, but it's also there in many other countries. If we look, for example, at the HRS, the Health and Retirement Study family of studies that covers 45 plus countries around the world, there are very few studies in that family that are collecting objective sensory data, a lot with self-reported data, but very little objective sensory data. Certainly there are some, LASI in India, Halsey in South Africa, Tilda in Ireland. They've all collected some objective sensory data, but there's really not a breadth of objective sensory data from these nationally representative studies.
That's interesting. And, metadata is our bread and butter. We couldn't do what we do without good metadata, both at the collection level and the variable level. And so I imagine that it just must have been such an endeavor to go through and discover this gap across US national and international collections. So the work that must have gone into combing through to say, hey, yeah, we needed this. It's not here. Where else isn't it at? And then going into like the process of developing those measurements and collecting the data. Yeah, I'm sure.
Right. That's right. And I've been, of course, very fortunate to have wonderful collaborators, both in the vision space, but also experts in other sensory functions in hearing and olfaction, for example, who've really led the charge on a lot of that. And a lot of this understanding that there are major gaps in the data and that there are major gaps in use of the data, even the data that's there. And that we as sensory aging researchers, which is kind of what we've come to call ourselves as a broader group now, would like other people to be using the data that's out there, would like to be training junior investigators and postdocs and doctoral students and medical students to be interested in this field and to be doing more gerontological research as it pertains to sensory health. And so based on those desires and based on these data gaps, myself and four other researchers from Johns Hopkins University of Chicago founded a group called the Sense Network. I encourage everybody to check out the website, sensenetwork.org. And really, we created this group initially as a really just a platform to get the sensory aging research community together for monthly meetings, talking about issues that the research community is facing, to provide opportunities for leaders and students and trainees and senior faculty to give talks and network. And it's evolved into something even more than that. That sort of central piece of the network exists, and we meet monthly, and we have great invited speakers. And I'd encourage everybody to be to join us and be a part of that, and certainly to register at our website for that. But we've also had the good fortune of working with you and Jim and other folks at NACDA to think about how we can build a resource for aspiring and existing sensory aging researchers who want to find where the data is that they need, right? So a metadata repository focused on sensory aging research. And we've begun this process. It's going to be a long process, and there's a lot of work that'll go into it. But NACDA is hosting some of the fruits of that early labor, where we're starting to denote what data in the NACDA collection is available that has sensory measures. We're parsing through whether those are self-reported, objective, what senses they query, and we're providing that on the NACDA page to data users. So that's one of our long-term aspirations, is to build that out and ultimately to be able to provide a platform for harmonization of some of that data.
Thank you. Yes, so we are happy to host that, and have appreciated the work that you and your team have put into that. Identifying which studies have variables that are indicators of sensory impairment. I think it takes a lot of effort to comb through the variables and decipher how things are asked and how they relate to each other. So with trainings and outreach in mind, what advice would you give to others trying to use data on sensory impairments or specific data collections like NHATs?
Yeah, I mean, I think one of the things that I've found when working with a new data source is generally the people who know that data, oftentimes the people who created that data, are very accessible. And if there's something more you want to know about the data or learn about the data, it's often quite feasible to actually reach out to the people who helped to create that data, and that can be very helpful. In the absence of that, finding people who are familiar with the data and have used that particular data as it pertains to sensory impairment can be helpful as well. I would say there are a lot of great data sources out there. And oftentimes it's not the quality of the other data, it's the quality and quantity of the sensory data that's limiting. So it's often, if one has a question particularly pertaining to some gerontological syndrome or major gerontological issue other than sensory health, it's relatively easy to find strong data on those issues. It's oftentimes the sensory data that's tricky. And so, those of us who are familiar with the data, and certainly the series page that we're working on with you and Jim at NACDA can serve as great resources. And I'd also advise that you come to the Sense Network meetings. We have opportunities for networking and for Q&A and to meet with some of the experts in the field. And that's oftentimes a really great opportunity to learn about who's doing what with sensory aging data. And sometimes we even have specific talks on specific data sources. So that can be very illuminating if there's a certain data source that you're looking forward to using.
Thank you. That's wonderful. Yes. We had an interview with the 2021 ICBSR research paper winners, and they said the same thing. They said, you reach out to people within your network, but also even people at other institutions. If it's a topic that you're both interested in, people are usually very accommodating when it comes to giving advice on those things. And I've attended some of the Sense Network meetings, and it seems like a wonderful mentorship opportunity. There are people, newer researchers who have presented, as well as established researchers, and the the back and forth is very supportive. So yeah, I think that's great. Thank you. All right, so we'll be wrapping up here, getting into the last couple questions. Could you talk about what excites you about being a researcher now?
Yeah, one of the things that really excites me about being a researcher, particularly in the space of vision and aging, is that we really are, I think, on the sort of precipice of doing really big things. Generally, kind of in the field of vision impairment and blindness and getting services to those in need, which largely are older adults. There's really a push now from the WHO, from the United Nations, to adopt eye health indicators in national health plans worldwide, and to really push towards adequate coverage of really for the two big conditions that affect most people, cataract and the need for glasses. These are the things that cause most vision impairment and blindness worldwide. And so I think we're going to see really exciting strides made. We were talking before about the global burden of disease, really exciting strides made in the prevalence of vision impairment and blindness as some of these indicators are actually put to, actually implemented and reported back to the WHO and integrated into national health plans globally. And so there's some exciting work going on in that space. When we think more sort of gerontologically about the impact of vision impairment on cognitive health, on falls, on these sorts of things, there's some really exciting interventional work that's just getting off the ground to test whether correction of vision, whether through cataract surgery, through providing glasses to those who don't have them but need them, can actually bend the curve on some of these outcomes, can actually be the lever that we need, at least for a subset of older adults, to slow the rate of cognitive decline, to prevent falls, these sorts of things. And some of that interventional work we hope will be really transformational and provide a conduit to really make a difference in people's lives.
It sounds very promising. And I do hope to see those interventions make the kind of change that we hope for. It would just be, I mean, the impact it would have is infinite, across people.
It really is. It really is.
So if there are any other data sets or conferences or networks that you would recommend, please share them.
Yeah, so in the vision research community, our big meeting is the Association for Research in Vision and Ophthalmology, which takes place usually the very beginning of May each year. And this year it's early May in Denver. And so I'd encourage those with an interest to certainly attend ARVO. It's a great meeting. It's very research focused. And there's always a carve out focused on clinical and epidemiological and health services type work. The conference is huge and broad and extends far beyond that, but ARVO is an excellent meeting. GSA, the Gerontological Society of America, which I imagine many of your listeners are familiar with, has been hosting the past several years several symposia on sensory health. And several of my colleagues established a sensory health interest group a couple of years back, and so we've been trying to push for greater traction in this domain at GSA, and I think many of us will have presentations there focused on sensory health. So GSA is another great place to look. And then for those who are doing work on sensory and cognitive health, AAIC, or the Alzheimer's Association, typically will have several presentations focused on sensory and cognitive health, which is a great area of interest of mine and several of my colleagues.
Thank you. That sounds great. Yes, we always attend GSA, so we can confirm that is an excellent meeting to attend. So thank you so much, Josh, for joining us, and to our listeners for tuning in. And we look forward to working with you more as our Sense Network series page evolves and, continue seeing you at meetings.
Yeah, this was fascinating. Thank you so much, Josh. It was was impressive, the work you're doing. And we're very pleased to know you and hopefully to continue to participate in the Sense Network and to work with you and your colleagues on promoting these important issues. So,
Thanks so much, Jim and Catherine. It's really such a pleasure to work with you both and an honor to be a part of the podcast and to be here today.
Thank you. Okay, so we will share the links to studies and other references in the YouTube description. And if anyone listening has any questions or ideas, please email us at icpsr-nacda@umich.edu. Thank you.